Tom Bialik with the Hobart Chamber of Commerce, coming to you today with a very special report. You may have seen all the TV commercials about Medicare open enrollment, and to answer some of those questions, we've asked Fatima Shabaz from Humana Health to come in and just talk with us a little bit. Fatima, thank you so much for joining.
Thank you. Hello, Tom.
Now, in regard to open enrollment, first of all, share with us a little bit about what open enrollment even is.
So open enrollment, it starts October 15th through December 7th. Those are for people who have HMOs and PPOs that may want to switch now or drop it to straight Medicare, or it's a good time to compare your prescription plan now with other companies.
Now, Medicare can be somewhat of a confusing topic for a lot of people. In fact, before the video, I was even asking, well, what is it? How does it work? And I'm kind of at that point in my life now where I'm starting to think about these things and I want to prepare for the future. So first of all, when should someone even start thinking about or preparing for Medicare health coverage?
So if you're going to be turning 65, I would say a year in advance, you might want to go over as to what you're going to actually be bringing home with Social Security. Because remember, this will be a fixed income. So you want to make sure you have all your ducks in a row. Your initial enrollment period is the month that you turned 65, 3 months before and 3 months after. So actually there's a 7-month window to apply for your Part B. Okay.
So let's take this back a step. First of all, many people or some people think that Medicare it's free, that it's covered, it's your benefit through the government. That's not true, is it?
No.
There is a fee, a monthly fee
for
Medicare coverage, which is approximately how much?
Well, just so you know, you'll get this red, white, and blue card. It'll say Part A, okay? The A, they've been taken out while you were working. Part B, which will take care of 80% of all your medical bills, will be $148.50 for 2021.
Okay.
And I believe for 2022, they raised it $10 more, so it would be $158.
So as we've been working throughout the years, there has been a deduction from our paycheck that goes into Medicare.
Right off the top.
To cover us when we get to that point where we want to start to take advantage of the system. But on top of that, there's still another component that we have to pay for, either out of our savings, out of our Social Security check, out of our pension, whatever. But that needs to be, and that's approximately $150 per month.
That's for 2021. For 2022 would be, if you want to, $160. Then we'll just say $160.
$160 per month.
And they take it automatically out before they deposit your Social Security check. Okay.
And what does that now when we're technically receiving Medicare cover? What does that cover?
So it covers your doctor visits, your maintenance upkeep like mammograms, maybe flu shots, things like that. Hospitalization, that's your Part B. Just keep in mind though, even though you're paying that $148.50 or for like next year it'd be $158.50, if you go with straight Medicare, you're still responsible for the other 20%. So that $148.50 that they're taking out this year covers 80%. Still, the other 20% would be your responsibility. And that's the time when people decide, well, I think I want extra health insurance.
So just to clarify then, Medicare will cover 80% of an illness, hospitalization. 20% is still up to
your
me.
Responsibility, yes.
Okay, and that's where you come in. That's where the supplemental coverage through Humana Health comes into play. Tell us a little bit about that.
Okay, so Humana offers Advantage plans. Those are your HMOs and your PPOs. And people say, well, what is that? You pay as you go. I guess that's a good way to remember. It's considered a Part C. Just keep in mind, Part C stands for co-pays. That's your HMOs and or your PPOs. And then there's also a Medicare supplement where it picks up the other 20%. It piggybacks off of Medicare. So that one's a flat premium though, and it will go up every year as you age, okay? Keep in mind, during that 7-month window that we were talking about earlier, that's the only time they cannot ask any health questions regarding Medicare supplement. And no matter what you decide to do, you want to make sure you get a prescription plan known as Part D. D stands for drugs. That's a good way to remember. If you don't, you get penalized 1% of the national average per month until you get that Part D coverage. Now, when you do, and say you let it go for 12 months or whatever, those 12 months will be, that's your penalty. They'll come up with a number, and that stays with you until the end of time. So you
Okay.
can't get away. Once you're penalized, it's forever. It
So
doesn't matter what company you
that's
go with.
another something that people need to realize and know about. You need to be 65 in order to qualify for Medicare, correct?
No, if you're on disability too, they'll get A and B. So the only thing that anyone on A and B could go with straight Medicare, or they can go with the HMO and PPO. And real quickly, the difference between the HMO and PPO. HMO, it's a good way to, it almost spells like home, means you always have to stay in network. If you don't, then 100% of it is your responsibility. PPO allows you to go out of network at a certain percentage, though, would be your responsibility. So that's a good way to remember. So if you're going to travel still within the United States, PPO is the way to go. If you're the type that said, no, that's it, I'm done, I'm going to just be here locally, HMO would be the way to go.
So for someone who is working for a company where they have health insurance and they're 65 years old, they don't necessarily need to initiate their Medicare coverage if they're still covered. But if they're not covered,
Then you want to apply.
then that's when you want to apply.
Yes, because unfortunately some people think, oh, I'm 65, I better call Social Security and get my Part B active. Don't do that if you're going to work another 5 years and your company is going to go ahead and take care of your medical and your prescription plan. So don't do that, because I had a couple people that had no idea, and they ended up paying not only for the Medicare Part B, but they were also paying their employers. So keep that in mind. If you're going to work past 65, you do not need to apply for the Part B, only when you're getting ready to retire.
Retire from that job that offers you those health care benefits.
Correct.
Once that's gone and you're 65, then you want to initiate Medicare.
Right, or if you work till 70.
Or whatever age.
Yeah, so then that'll be at your open enrollment where they can't ask any health questions, things like that. So just because you turn 65 and you're still going to work, remember, stay with your company, unless, of course, it's more expensive than what Medicare has to offer. So that's a good time to compare as well.
There's certainly a lot to know, a lot of questions to ask, certainly many more questions than we can take care of in this short video session. If someone wants to learn more about this, and if they want to contact you, Fatima, how would they do that?
Okay, you can contact me at 219-501-1355 or at 219-576-3200. I also have an email, F as in Frank, Shabaz, and that's S as in Sam, H as in Harry, A as in Apple, B as in boy, A as in apple, Z as in zebra, at humana.com.
And right now is the open enrollment period, which began
October 15th
October 15th and goes
through December 7th.
December 7th. So we have a few more weeks to contact you.
Yes.
And get on top of this.
And so, something new that they started too. So January 1st through March 31st, they have another enrollment. It's pretty much say you signed up for the HMO, and then come January, February, you said, no, I wanted the PPO. You're allowed one time to change it from the January 1st through the March 31st. Yeah.
Good to know that also.
Yes.
She's Fatima Shabaz from Humana Health. A lot of questions to ask. Once again, I'm Tom Bialik with the Hobart Chamber of Commerce. Thank you so much for joining, and we'll see you next time.